By the end of the week, dentists in 40 states will be allowed to see non-emergency patients again. Today, dentists in Connecticut are telling people to open wide. MSNBC senior national correspondent Chris Jansing shows us the safety precautions they're taking.
Connecticut orthodontist Dr. Gary Open is back in business, fully reopening his office today.
We do have quite a backlog. We have been closed for 6 weeks.
The new normal means keeping patients safe in the age of COVID.
We are wearing higher level masks, N95s. We are wearing face shields also, and we're wearing disposable gowns.
He's overhauled his office, investing in a new air filtration system, significantly reducing the number of patients he'll see each day, and revamping waiting room procedures.
Their temperature will be checked. Once everything is deemed okay, we will escort the patient to the chair where we'll be working.
Dental practices are by nature invasive, and preliminary research suggests the coronavirus survives airborne for hours. That's why some industry insiders like hygienist Megan Zadrowski worry dental offices are reopening before it's safe.
Aerosols generated in the dental office are unavoidable, whether it's by dentist drills, whether it's by hygienist instruments, or even the patients themselves who may need to cough.
The American Dental Association has issued national guidelines, including hygienists using hand tools instead of automated devices and limiting drills, suggestions that Zadrowski worries not all dentists will follow. Would you go to a dentist right now for a non-emergent problem?
I would absolutely avoid going to the dental office with a non-emergent service.
A recent national survey by the American Dental Association found 3 in 10 dentist offices didn't have any supply of N95 masks, and nearly 18% had no face shields. Connecticut dentist Dr. David Fantarella says it has been a challenge.
We do have what we need. It has not been easy.
He's invested beyond the guidelines, including a fogger to clean rooms and a mobile UVC unit to reduce pathogens. You understand why people are nervous.
For sure. I'm nervous, but I'm also nervous on the flip side of that. If we don't do anything, what about that patient?
That they get really sick.
That they get really sick.
All dentists facing the new reality that being afraid of the dentist means something different now.
I wanted to make sure my child was safe and comfortable in a setting outside the home.
What are you looking forward to most when all this is over?
Well, getting my teeth straight, definitely.
The challenge of reopening a business when it's anything but business as usual.
And Chris Jansing joins me now. Chris, let's talk for a minute about the economics here. I mean, this is an industry that's taken quite a hit, and it is not cheap to put all of these new safety procedures in place. What kind of challenges are they dealing with there?
Yeah, you're right about that. Not cheap at all. And the couple of practices that we went to in Connecticut, they are both long-standing. They've been in operation for decades. They're successful practices. If you're a smaller practice, if you're a rural practice, if you're a new practice, first of all, there is the financial consideration, right? The second part of this, really, I think there is a comparison to be made to remember how difficult it was for so many hospitals, and still is, to get that bottom line where they want it to be, given that they're not doing elective surgeries. They're not doing any kind of elective office calls. So that's the other issue. And there was a survey that was just done, Allison. 46% of dentists said that if they aren't back up and operating by the end of August, they're not sure that they can stay open. And often the big concern is those will be the practices in rural areas, already underserved areas, places where people don't have other options. So that's why the ADA is keeping an eye on all of this to see how this rollout works, what are sort of the red flags, and how they can help some of these practices that aren't open yet reopen safely.
And Chris, how about the patients? I never thought I'd say this, but last week I said to my husband, I'm dying for a teeth cleaning. It would feel so great. I know so many people are skittish about going to the dentist to begin with. Is there a concern that may be even worse now?
Yeah, I mean, obviously, it's a very different kind of concern, right? I think a lot of the concerns that people had a decade, 2 decades ago, simply about pain, the fear, the noise of the drill. There have been technological advances that have calmed a lot of those fears. But for the average person, when you're told, don't even go out of the house, and now you're being told, hey, you can go have your teeth cleaned, and like you were just saying, you feel like, my gosh, I really want to have this done. There are several things you really should think about doing. First of all, call your dentists. These offices are already getting the calls. They're ready for them. You should ask them what kind of PPE are they wearing? What kind of air filtration system do they have? That was the #1 concern for the hygienists. Do you have the right kind of air filtration system? And then you have to ask a personal question. It's really about, is this necessary? Do I feel comfortable? If you don't feel comfortable and it's not an emergency, there's no reason right now not to stay home. Allison?
Chris, great questions to ask. Thank you so much.
Thank you.
President Trump's feud with the World Health Organization is heating up. He threatened to permanently cut off U.S. funding unless the WHO commits to, quote, major substantive improvements in the next 30 days. Today, the head of the organization's emergency program urged people to stay away from the anti-malaria drug hydroxychloroquine, which President Trump is taking.
At this stage, hydroxychloroquine, norchloroquine have been as yet found to be effective in the treatment of COVID-19 or in the prophylaxis against coming down with the disease. In fact, the opposite in that warnings have been issued by many authorities regarding the potential side effects of the drug.
NBC News senior international correspondent Keir Simmons joining me now from London. Keir, the WHO Director General started his briefing by thanking member nations, leaving the U.S. off that list. What is the organization saying or not saying, I guess, about Trump's letter?
Well, Dr. Tedros has had a rough time in recent months at the hands of President Trump. Dr. Tedros, of course, is the Director General of the World Health Organization. I mean, this is the letter that President Trump wrote to him, questioning the World Health Organization's relationship with China. It raises some important questions. It raises some good questions, Alison. So, for example, it asks about the relationship, the role of Taiwan. Now, of course, you'll know that Taiwan is considered by China to be part of one China, and China has resisted again and again, including during this assembly over the past few days, for Taiwan to be involved in the World Health Organization. There are many who think if Taiwan had had a voice, it would have raised concerns about the coronavirus earlier. President Trump makes that point, so it's a good point. But there are lots of other issues, claims in here and accusations that just don't stand up. So, for example, he accuses the leader of the World Health Organization of praising China for its transparency. President Trump himself, earlier this year, praised China for its transparency. And another issue which is going to really make it challenging for America's allies around the world is this letter gives the World Health Organization 30 days, Alison, to come up with a plan to do things differently and not be so China-orientated, but it doesn't really give any proposals on how to do that. So it's very difficult. If America did leave the World Health Organization, it would be very difficult for our allies to follow, and it would therefore be a pretty difficult diplomatic position, frankly.
How are the other member nations responding? What kind of reaction are they giving?
Well, it's just another example on the world stage of major countries around the world, nations that consider themselves to be allies of the United States, really just having to kind of take leadership. So what we saw on Monday at the beginning of this summit that's been described as perhaps the most important in the history of the World Health Organization, we saw Angela Merkel of Germany, Macron of France speak to the assembly. We saw President Xi of China speak to the assembly. Who we didn't see President Trump. Instead, you saw the Health and Human Services Secretary leading the American delegation. The thing is, though, Trump could have spoken. He could have said all the things that he said in this letter at that forum, and also did some other things, kind of stand behind other allies, and he didn't do that. And many people think that was a lost diplomatic opportunity.
Yeah, absolutely. Keir Simmons in London, thanks so much for being with us.
You bet.
Department stores hoping to woo back customers as they reopen their doors. Retail sales plunged a record 16% in April. So will those shoppers come back? And what will the in-store shopping experience be like when they do? NBC News correspondent Blaine Alexander is in Atlanta, taking an NBC exclusive look inside Macy's to show us what reopening looks like for the company. Blaine, what is Macy's plan specifically? What are the new safety measures that they're putting in place in store?
Allison, it's going to certainly look different. You know, when you walk into Macy's, one big thing that people usually go inside for is the makeup counter. I know that you've done it. I'm sure that a lot of people have done it. You go inside, you want to try on makeup, try on lipstick. Of course, given everything that's going on right now, that's not a possibility. So that was my biggest question. I actually stopped by a makeup counter and had what will be kind of the new demo for makeup counters. So instead of kind of putting foundation on your face, they have these pads that actually have a face drawn onto them, and they take, you know, essentially what the person is going to do is going to eyeball you. She says, you know what, if you're looking for foundation, I'm going to eyeball you, see maybe 2 or 3 shades that might work for you, and then she's going to put them down on this pad the way that she would apply them to your face. So not only are you going to see what it looks like, but you're also going to kind of see how to do it. And she actually demonstrated for me taking a Q-tip, spreading that product on the paper. It's certainly not what we are used to at all, but this is what they're doing to get back up and running. You know, there are plenty of safety measures that they're talking about, things that we've seen in stores all over. So employees required to wear masks. We're talking about plexiglass around cash registers, social distancing, of course, but the things that are unique to department stores, like trying on clothes. So I asked, can we still go in and try on a dress or a pair of pants? They said yes, but once you decide that maybe you're not going to purchase that item, it goes on a special rack, and that is then put away for at least 24 hours. It's kept off the floor, off the public racks, and then it's slowly kind of rotated back into service. So that's what happens when you try on. The same thing, Allison, happens when you return items, if you do decide to return something to the stores.
Okay. So different, Blaine, all of those things. You mentioned some of the safety measures in place for the employees. What else do we know about the employees who are coming back to work? What can you tell us about them and their safety concerns here?
Well, we do know that Macy's, just like many other retail places, have really been hit hard by this pandemic, right? So we know that Macy's Incorporated had to furlough many of its 130,000 employees. So a lot of them are going to be coming back to work, certainly, you know, looking forward to getting back to work and kind of welcoming customers back into the stores. But there were a number of people who continued to work during this pandemic because Macy's was focused on digital sales. You know, we know that some of the stores kind of remained up and running in terms of getting that product out, shipping them to people who were ordering online. But with the stores opening now, we know that employees are, again, required to wear masks. They're coming in. They have plexiglass around the cash registers. And we're also seeing kind of staggered shifts and staggered openings as well. So you're not seeing as many people in there at the same time. I do have to say that we went in there, our small crew went in there before the store opened this morning, and people were very much spread out. And when you kind of see, you know, you get ready for a sales floor to open, you may see more than one person in a section folding places or straightening things up. We only saw one person per area, so it certainly looked like there was a great deal of distancing going on, as much as could be done on the sales floor. Allison.
Blaine, it is certainly going to be very different shopping in stores again. Thanks for giving us a glimpse of the new normal.
Yeah.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.